Well, you see, this is our preoperative examination. Now we'll enter the most important parameters into the system, and it'll definitely show us which operation to perform and how to do it. This is our development. It is unique and allows for operations with fantastic precision.
Mathematical modeling of the operation, the development of our leader, academician Dr. Igor Aznauryan, in my opinion, is a brilliant invention in ophthalmology, strobology, and the practice of doctors dealing with strabismus surgical procedures.
If there used to always be an element of some kind of guessing in how the eye would settle after surgery, then this calculation allows for fairly accurate eye correction. This technology is a high-frequency radio wave with mathematical modeling, which we have developed and apply. It is already recognized in the world as the best for children, but also very effective for adults. Sometimes I had to do operations by intuition because all dosing systems were inaccurate. They gave a very large scatter, a very large range of performance. Yes, some patients had different outcomes with the same operations. They stood tall, while others, conversely, went the opposite way. Some faced a shortfall and had to undergo many surgeries. Hence, developing a system for precise eye alignment has been a long-standing task since the start of these procedures, specifically the mid-19th century. And for some reason, no one could, so to speak, in detail. Although there are no difficulties, there is an absolute trigonometric story there. You just need to correctly calculate the ellipsoids, see which angle of rotation will lead to which change in the position of the eye.
The program developed by Igor Aznauryan allows to perform calculations here and now, taking into account not only the angle of strabismus, but also determining the length of the eye, the child's refraction, the presence or absence of farsightedness, nearsightedness, the diameter of the cornea, and the interpupillary distance.
And our program takes into account all these little nuances that affect the result. All these parameters are in a mathematical trigonometric relationship. And when we calculate, it turns out that one person with the same angle of strabismus needs to perform an operation of one magnitude, and the other, on the contrary, is 2-3 millimeters larger. Therefore, we achieve our effectiveness.
Additionally, the program enables the determination of the probability of requiring additional interventions even after the second or third operation has taken place. And also, which is very important, it allows parents to show, that is, what the result will be after the operation and what we will do next. And in addition to that, this program, which was developed by Igor Aznauryan, enables you to navigate the path in order to minimize the number of operations that may be necessary in this specific case. This program gives us the ability to calculate at this very moment, specifically for the period of time when a child is diagnosed with strabismus. So if it's per year, then per year. If it's per 3, then per 3. And all subsequent growth, according to the scientifically called refractogenesis, which can occur in the visual system, is provided by this program.
When we devised it, we had a query of a distinct kind.
We must ensure our calculations match our actions, and during that time, the operations were highly traumatic. Large needles cut with scissors, scalpels, a lot of blood pours out, then a powerful soldering process begins. All this also impacts the operation outcomes. Thus, it was necessary to develop a new method, a new technology that would enable these operations to be done gracefully. We developed a minimally invasive technology that enables us to perform the operation without post-operative changes affecting the calculation result. Here, in fact, these two factors together create this fantastic effect. The most important aspect is that besides eye alignment, it also enables rapid patient rehabilitation. Almost on the same day, the eyes open. On the same day, you can read, write, watch TV. The patient may be discharged. There are practically no strong edemas. Recovery happens very quickly.